So for the purpose of my video, I will be doing an assessment on a postpartum client who had a vaginal delivery and is planning to breastfeed. So to begin, I would introduce myself, I would provide privacy, perform hand hygiene, perform all my safety checks, and then identify the client using the wristband. So I would ask, what is your name and what is your birth date? And then I will just let the client know, we just want to make sure everything is okay since you delivered your baby. Are you in any discomfort or pain? And from here, I would do a pain assessment using the PQRST tool. And I would ask, is the pain tolerable with or without medication? And then I would ask, do you have any questions for me at this time? And then I would begin my assessment using the bubble heat tool. So to begin, I would start with the breasts. So I would assess the breasts and the nipples. The breasts should be soft and the colostrum may be expressed within the first couple of hours. And then as time goes, the breasts will firm up as they become more full. And when you squeeze the nipples, the colostrum should be coming out. And then the nipples should also be intact. You want to assess for cracking. Assess for any pain. If there are any lumps, lumps can indicate that the milk ducts are clogged, and then you want to educate the patient to massage the breasts. And then I might ask, how is the baby nursing, and assess the client's understanding of breastfeeding. Next, I would check the uterus. So I would assess the fundus, and how I would do that would be that I would put a hand close to the pubic bone to support the uterus and feel for the fundus. And the fundus should be firm to touch. In the first couple of hours, it will be one finger above or below the umbilicus. And I want to educate the client to empty the bladder frequently. And then after, I would assess a bowel. So have you had a bowel movement? Are you passing gas? For the first 24 hours, it's normal for clients not to be having any bowel movement. She may have hemorrhoids, so you want to discuss about hemorrhoid care, ways to prevent constipation, and the return of normal bowel movements. And then discuss about nutrition, fluids, and encourage ambulation. Next, I would do the bladder. So assess if she's avoiding comfortably. She is able to empty her bladder without feeling any pressure or fullness. Try to encourage her to void every 4 hours. She can use warm water over her perineum to help with voiding, sitz baths, Kegel exercises to reestablish bladder control. And also you want to assess for any distension, incontinence, urinary retention, and urinary infection if the client has a Foley catheter. And then you want to check the lochia, so assess the amount, clots, odor, color. And for vaginal births, you want to be checking every 15 minutes for the first hour, and then every 2 hours, and gradually to once per shift until she gets discharged. And then you want to change the pad every 4 hours and have her shower to keep the perineum area clean. And then a saturated pad within the first hour can indicate hemorrhaging, and a foul smell might indicate infection. Next, I would check for the perineal tear, so if she had an episiotomy. So assess the perineum, check the integrity. If it's healing well, if it's well approximated with minimal swelling and bruising, and provide any comfort measures. So in the first 24 hours, you can give them an ice pack, or you can give them some pain medications. And then using home ensign, which is a sign for deep vein thrombosis, which is a possible postpartum complication, the client would feel discomfort behind the knee upon dorsiflexion of the foot. So assess the client's calves for pain, tenderness, or redness, and check for edema in the hands, face, and the lower extremities. And then finally, you want to assess the client's emotional status. So assess client's comfort level and just how they are doing emotionally. And that is my assessment. Thank you.